Good morning, Pat Zemer here from Magna Wave. Welcome to the Magna Wave office hours. We come to you every Tuesday morning at this time to answer any questions that you may have with regard to pulsed electromagnetic field therapy. So we can familiarize you with that, bring you up to speed on any of those questions that you may have. We like to cover anything from training to machines to what's the differences in strengths and gauss, anything that you may want to know. We'd be happy to answer those questions for you. What we think we do to set Magna Wave apart, whatever it may be. So anyway, that's what we're going to do. That's what we're here to do. If you'd like to call, and there's a reason to call today, you can dial 502-599-9722. Send a text to that number. Text your first name to that number, and then I will call you back and we can have the conversation that you'd like to have with regard to any of those questions that you may have about PEMF, pulsed electromagnetic field therapy. So before we get into that, well, let me go back one more thing. We're in the holiday season here, so what I'm going to do is if you call and share with me your favorite story about Magna Wave PEMF and how it's affected something that you've been doing with it, your favorite sharing story about Magna Wave, we'll give you some Magna Wave gear. It could be a hat, it could be a jacket, it could be a mug, one of these kind of mugs that I carry around with me all the time, whatever it may be. Gear day here at Magna Wave. And if we get up to 50 viewers, I'll give away a couple of attachments, or I'll give away a PEMF device, one of our small new low power devices that we're going to have available. That's what we're going to do today. So text your first name to 502-599-9722 to ask a question, or tell us something about a good story that you've got about Magna Wave and PEMF for this holiday season. Okay, while I'm waiting for a text, because somebody's going to text because they want to get that gear, I want to tell you some new developments that have come up. We've talked a lot about CE, which is the international designation for an FDA type of device or safety type of device around the world. In Europe and Canada, South America, Australia, many nations use the CE approval. Now our devices, the new B2 machine, the Semi device, the Aries, which is a new device that's coming, and the Maya devices are all now CE approved. The factory's been approved. The safety testing for the machines has been completed and approved. So we needed to get all this stuff done. The factory audits, the company audits, to verify how they build the machines and what goes on with them. So now we have CE health device. There are two types of CEs that's used internationally. One just means it's electrically safe, and that it's an electrically safe device that can be used in those countries. The other is a medical usage for CE, and the CE that we have and that's been granted, and the stickers are being printed to start going on the machines, is a CE medical approval. So that means that it can be the devices can be sold into those countries accepting that designation for health purposes. And so that's going to be interesting as we develop that and kind of make that happen. Oh, we got a couple of people that are coming in here, so let's get on that. Let me open the first one here, and we'll give this a shot. Natalie is calling. Let's here we go. Okay, let's bring up Natalie. See if it's good. Here we go.
Hello?
Natalie?
Yes?
How are you? This is Pat Zemer with Magna Wave.
Hi, Pat. Thanks for calling.
Hey, good deal.
Good.
So, do you have a question for me, or you want to share one of your favorite Magna Wave moments?
Well, we've been using Magna Wave with my stallions for the last year. I used to use acupuncture all the time, and he hated needles. And he had a stifle injury from going through a fence. And the Magna Wave has been really wonderful at helping him heal the rest of the way and making it less invasive than using acupuncture. He really likes it and relaxes for it, and then I started using it because I have a fused neck from a car accident. And, when she comes up and treats my horse, I have her treat me as well. And I've found a lot of pain relief that I couldn't find any other way before. So I really appreciate Magna Wave and what it does, and find it very, very helpful, both in the healing process of new injuries and old injuries.
Great, Natalie, I appreciate that very much. That's a great sharing there. Here's what you need to do is if you will send your name and address to support at mwpemf.com, we'll get right back to you what gear is available and get you some gear.
All right. Well, I appreciate that very much. Thank you, sir. And you have a great day and a great holiday.
Natalie. Thank you. Bye-bye. Again, Natalie, that's send your name and address to support at MWPEMF, and we'll write back to you. We've got your list that you're on the list here to receive some gear, so that's a good thing. Okay, we have another one. Let's go here. It's from Jackie. Let's see what Jackie's got for us. Here we go. Dialing up. Always got to wait for it to ring to come together. Could do a little dance if you're listening to us.
Hello, this is Jackie.
Hey, Jackie, Pat Zemer, Magna Wave. How are you today?
Hello?
Hello, Jackie. Can you hear me? Jackie? Can you hear me? What's going on? Jackie, are you there? No? Jackie? Hello? Well, for some reason we don't have Jackie on the line. She came on. We'll dial it one more time. See if we can get her to be able to hear us. I think this will be fun today to see what folks are thankful for, how they've used Magna Wave.
Hi, Pat. Can you hear me?
I can hear you. Can you hear me?
I can.
Good.
I'm sorry. I'm watching you on the computer, so it's a little delayed.
No problem. So Jackie's with us. Do you have a question or you want to share a Magna Wave story with us?
I would like to share a Magna Wave story.
Okay.
I just received my Magna Wave back in September and got certified. And I've been having great success with it, but the biggest success was my own horse, who was having a small, bout of colic, gas colic. And I did a full body treatment on her and could just watch all her muscles just relax, and she started to feel so much better, within 20 minutes. So it was just an amazing thing to watch, a horse not feeling well like that, and have them just relax and feel better. It was amazing.
That's incredible. So did you do just the one treatment and you got a change in the horse's condition?
Just in 20 minutes. I mean, she was, again, it wasn't a, severe colic. It was a gas colic, but she was very uncomfortable. And, she started to just hang her head. I watched, her back was tense and hollow, and I just watched it open up like a balloon. It was amazing. It was just an amazing thing to watch.
Well, that's fantastic, and I really thank you for sharing that information. Now, what you need to do is send your name and address to support at PEMF at MW. I'll get that right. MWPEMF.com, and we'll get you some gear.
Awesome. Thank you so much, Pat. I'm just so happy to be part of the Magna Wave family. Love it. Love it.
Thank you so much. Have a great holiday.
All righty. Mm-hmm. You too. Bye-bye.
That was a great story about being able to use the Magna Wave to get some get some relief from a gas colic type of situation. And that plays out in animals, small animals. That plays out in people. If you're feeling some discomfort and gas and constipation type of thing, you might very well use the Magna Wave on your abdomen or whatever the area that you feel that you're having an issue, and potentially get some relief, the relief that you're looking for. So any other questions, please put them up there. Do we have any questions that have come up in the chat board, Brad? Yeah, there are. It looks like there's something. Here we go. How many Magna Wave machines? Oh my! How many John, you're asking a good question. How many Magna Wave machines are there now, and will any be phased out? Let's see. There is the one, two. I'm going to talk about models first, and then we can talk about different cases because some of them come in different cases. But we got the Max, the Maya, the Vesta Duo, the Aries, Simi, and then a couple low power machines coming. We have the Pulse Pro machine and the new machine that's coming, the Soul, the PMF Solutions Soul device. So that's 7. I believe there are 7 high power machines. Oh, and the B2. So there's 8 high power machines today, starting from the B2 all the way up to the Max. Will any be phased out? The plan is not to phase anything out at this point. Certainly there are some new models that have come in, and there are machines that are not as popular as they were at one time for whatever reason, because of the changes in technology and changes in people's desires and so forth. But there's really no plans to phase anything out at this point in time, particularly, John, in the CE designation area that we're going to use around the world for people to be able to use these devices doing other things going forward. So there's 8 different devices at this point, unless I've missed something in the count. Of course, they're all available on the website to view and learn about, and no plans to phase anything out at this point. Market will tell us what to do and how that will play out. Great question. Thanks, John, for asking. And then we've got a couple of texts here. Let's see. Let's take a look. This is from Liz. Let's call Liz up here. Okay. Here we go. Dialing out. See what we got, and then we'll have some other questions that are coming up for sure.
Hello, this is Liz.
Hey, Liz. Good morning. Pat Zemer with Magna Wave.
Hi, Pat. How are you?
I'm good. Do you have a question, or you want to share a Magna Wave story?
I wanted to share a Magna Wave story with you.
Okay.
My mom is going to be 96 next month, and she had some pretty significant arthritic changes in her knees, and she had a lot of venous insufficiency in both legs. Didn't have any feeling on the soles of her feet. Her nail beds were kind of pale, sometimes a little bluish.
Right.
And so when I got my Magna Wave machine back in August, that was one of the main reasons I got it. Plus, we also have standardbred racehorses, but Mom was the primary reason. Started using it on her 3 times a week, and after 3 weeks, she called me and said she slept through the entire night without any pain.
Wow.
And she'd been experiencing pain every night, had to get up in the middle of the night, walk around, try to, rub her knees, her legs, her feet, just so that she could get a little bit of relief to go back to sleep. And
right.
So she was very sleep deprived, and, it really impacted her quality of life. So keep treating her. Now I'm just basically keeping her on a maintenance 1 to 2 times a week. She has feeling in both soles of her feet. Her nail beds are pink, and she has 0 pain in her knees.
Wow, that's incredible.
So it is truly, truly amazing. I took her to our family doctor, and he was astounded. He could not believe the difference in her.
Amazing.
So needless to say, we are so grateful for this machine. It has really made a huge impact on her life.
Well, thank you so much. I appreciate you sharing that. Great story, and keep using it on her, and certainly take care of your standardbred racehorses as well. And that's wonderful. So, Liz, just be sure to send your name and full address to MW support at MW. They've got a different address. They both work. MWPEMF.com or MagnaWavePEMF.com. Thank you so much for calling, Liz.
Thank you.
Have a great holiday. Bye-bye.
You too. Bye now.
Wow, that was a great story. People of all ages can certainly benefit and utilize Magna Wave to help them to have better wellness and feel better and just be better prepared for their bodies to heal themselves. We have another one here from Hazel. Let's see here. Let me do some dialing. I hate to not be talking while I'm dialing, so we don't have... I think I made a mistake. Let me go back. Let me do the whole thing. I made a mistake there. See, I got excited about trying to keep communicating and misdialed. So here we go. Oh, now it's busy. Let's try it again. Well, phone issues. Okay, here we go. Okay, got the number dialed. Hit the dial. Here it goes. We're going to ring up Hazel and hopefully get another good Magna Wave story. Good morning.
Good morning.
Hi, Hazel. How are you?
Pat. I'm good. I have a few testimonials, and one leads to the other.
Okay.
I broke my greater humerus last spring and had a practitioner work on it, and the orthopedic surgeon, after I went back after 6 weeks, couldn't even tell where it was broke.
Wow.
So that was major. I wasn't able to get in contact with her or meet with her all summer to get treatments for my rotator cuff. So I bought a machine. And my rotator cuff is totally healed. And so this leads to another a high school football player dislocated his shoulder, and so then he had rotator cuff problems. And I gave him 3 treatments. The first treatment, he couldn't lift his hand above his waist.
Wow.
After the 3rd treatment, he could raise his arm, and he has had no problems after that at all.
Wow. High school football
Magna
player.
Wave has high school football player, yep. And he came back because he broke a bone in his hand, and they're just so thrilled with this machine. They're like, oh, thank you. It's such we are true believers, and honestly, so are we.
Well, great. Hazel, I really appreciate it. Great testimonial, great stories. Thank you so much. And don't forget, send your name and full address to support at Magna Wave PEMF, and we'll get you some gear. Have a happy holiday.
Thanks. You also. Thanks, Pat.
Bye-bye.
Bye-bye.
Okay, we got another one. Post-operative. Yeah, sure. Let me pull this up here. Here we go. Several testimonials. Oh. Misdialed again. So I punched a button wrong. Oh my gosh. I need to have somebody good dial these things for me so I can don't lose track of what's going on. Slow down. Okay, got it up. Dial it up. Here we go. This person's got dozens of testimonials. Let's get the good ones.
Good morning, Pat.
Good morning. How are you?
I'm doing great, thank God.
There you go. Who do I have?
It's Kathleen Myron.
Oh, hi, Kathleen. Great. So you got some testimonials. Give us the one or two best ones.
I tell you, I every day I could share another story. But I'll tell you quickly about my daughter, Katie, who had a tonsillectomy last month. Her tonsils were so bad they were pressing together. Every time we'd Magna Wave, of course, we'd get some resolution.
Right.
But then it would, if you weren't using it constantly, clearly these tonsils were problematic. They had to come out.
Right.
So what we did was I put on a protocol of I treated her quite aggressively about a week or two before the surgery. Every day. Okay. After the surgery, I waited about 3 days because that's what I typically do. I usually give it a 3-day window.
Okay.
Because you have risk of bleeding.
Right.
So I started out with like a low pulse, like about a 20-minute, just real low setting on the 3rd day. But that was helping her. But the medication she was on, she had an adverse reaction. She was completely vomiting. She was had the head spins. I thought I was gonna have to take her to the emergency room. She was so sick.
Oh my!
So I got her off the medication. Waited about 6-7 hours. Kind of cleared out of her system.
Sure.
Started Magna Waving her aggressively because this was a situation that you don't go on low pulse. So I put the lasso around her neck, and I turned it up to about a level 7, which was about as much as she could tolerate.
Right.
And I did that for about an hour, like morning and night. She was fine. I mean, after the first time, she was fine. Had no vertigo. She could not get rid of the vertigo. She had that medication. So I think it helped to detox that medication, get that out of her system, took down all that inflammation and swelling and the pain. Her pain level was beyond a 10. Took that pain down to about a 5.
Wow.
And she was able to manage her pain without any pain medications. And she really, it was a tough, because she's like almost 17. It was a tough surgery for someone that age.
Right.
And honestly, you know, she went 3 weeks later and had her post-op, and the doctor had to look at the report. He thought that she was a couple months out after having her tonsillectomy. And I said, no, she just had them out 3 weeks ago. So she had a remarkable recovery with, with treating with what I had done.
Right.
You know? Again, I was a little reluctant to start treating too
soon,
much,
right, because
of the vasculature increasing circulation with the tonsillectomy because of blood flow,
right,
in that area.
Right.
So, but then you have to discern at some point where there's so much pain involved.
That's right. Pain's no good.
Yeah. So it was tremendous, with her recovering her after her tonsillectomy. And then, of course, my own our personal horse situation where it was colicking, slipped out, because I've treated a lot of colic horses at our barns, of course, but you're kind of more, objective.
Right.
Even though I love the animals, it's not my animal.
Right.
And when it came down to our horse, my daughter's world champion horse that she's won in nationals and all that, and world champions, he came out here to Ohio after being in Southern California and colicked 2 months after he was here, had a big old lipoma, and they removed it without resecting it. He was a slow recovery. I was reluctant, I had to educate the doctors here on Magna Wave because they didn't want me using it on him.
Right.
After 3 days, I finally was able to, I was working on some of the Amish horses here, and then they saw, and the Amish people were there, and they knew about Magna Wave. So I actually helped them recover a horse there that, while I was there at the animal clinic, who had a fractured leg, treating it, this is while my horse was there,
right,
treated this other horse, a standard bred horse, with the large loop around the leg while it was splinted. They were going to put the horse down, but they were going to give it 3-4 days. And I treated the horse every day very aggressively, actually, as long as the horse could tolerate. The horse let me know. He started nudging me when he was done,
right,
which was usually about an hour. And I did it once or twice a day for him. And that horse was full weight bearing. Of course, he wasn't out, dancing, but
right,
he was able to bear full weight on that leg after on the 4th day.
Wow.
And he was able to go home. That's
incredible.
And the Dr. Milligan there at the clinic in Burton, she was amazed. So between her splinting technique and the Magna Wave, it saved that horse. And our horse, in the meantime, just, I was Magna Waving him, and we kept having these conversations. We finally came to conversation about 3 weeks out that we were going to maybe put him down because he would get better and then he would relapse. He'd get better, he'd relapse.
Right.
And they thought he was forming adhesions. Well, I just got real aggressive on the Magna Wave. He told me not to go over the suture lines. I did not. I avoided the suture line area.
Right.
But I went around it, increased it. We just really amped it up. We combined that with a little bit of some acupuncture as well, because
sure,
I don't think one thing is the be-all, end-all.
Sure.
But I'm going to tell you what, that horse wouldn't be here today, and I don't know the emotional status of my daughter if that horse would have died at that time.
Wow, that's incredible.
Would have taken her down. But we had the conversation. We're going to, maybe the horse heard, I don't know, but we said, we think we're going to have to put him down this evening. I Magna Waved him very aggressively on the high setting for a few hours. We were all in tears, sobbing. We went out and got some coffee and came back 2 hours later, and he went from laying down at the end of the stall like he was just going to curl up and die to he was standing at the front of the stall waiting for us to come with his ears forward.
There you go. That's incredible.
We took him home 2 days later. He had some situations afterwards of gas colic from dehydration. Magna Wave, like the other gal talked about, gas colic. It was self-limiting. It resolved with the Magna Wave.
Wow.
So I'm telling you, this works. And my daughter, close to home, and I have my own stories as well. But every day, I'm so blessed to have this device. I can't even say
Well,
enough.
thank you. Those are a couple of great stories, and we always enjoy hearing from you. And thank you.
Yeah.
And I want you to have happy holidays. Be sure to send your information to
Merry Christmas.
support at magnawavepmf.com. We'll get you some more gear.
Of course.
Thanks
so
Kathleen.
much. Okay. Bye-bye now.
Bye-bye. Great stories. I mean, this is really fun. What a great way to kind of look at and celebrate the holiday. I think we have some questions here. Let's see what we got. From John again. Has anyone used Magna Wave on the feet only and felt systemic effects? I would say, John, that I treat my feet daily, feet and lower legs daily, and certainly can tell a difference in the circulation in my legs and feet that I've experienced. And my doctor just says to me, well, you're getting old, you're going to have those kind of things. That's no fun. But at any rate, it certainly helps. Now, from a systemic application to treat the feet, the feet quite often, for reflexology, when we treat headaches, we treat the feet. So to treat the feet to enhance the body, the way reflexology is used to enhance the body can certainly lead, I would think, from treating the area to systemic results or systemic effects throughout the body. From the blood circulation issue, obviously the blood's coming down, circulating through the feet, and then moving on to the rest of the body. So if you are treating the blood in the feet, that's going to go everywhere. You're going to see, we find that if we prick someone's finger, treat their low back for 15 minutes, come back and do a dark field microscopy, that the overall systemic blood flow is improved just that fast. And we're not talking about microcirculation, I'm talking about overall body circulation, so an improved blood flow. So most certainly, John, you can treat the feet and lower legs and get a full blood rejuvenation, revive to thrive type of action throughout the body. Good question. Thank you, John. I think there might be another one. Let's see what we have here. My Maya sometimes has an inconsistency in the pulse. I have done the reset. It still does happen. Not all the time. Do I need to do the reset on a regular basis? Any idea why this happens? Thanks. Of course. What happens is you're putting a magnetic field, a magnetic signal into the body. And the body offers resistance. And in many cases, depending on the moisture content, the muscular content of the body and what's going on, you can get what is termed as an inconsistent. It'll go click, 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 and it's responding. It's a responsive type of action to the energy and the EMF that you're putting into the body. It's normal. It doesn't occur on every person. It doesn't occur at every location of the body. It just depends what's happening with that type of situation. It also has something to do with the environment that you're in. If there's moisture in the air, a lot of static in the air, this is an electrical impulse that travels through that coil to create the magnetic field that penetrates the body. So it can be influenced by the environment around it as far as moisture, sensitivity, so on, a static like electricity and things like that can on occasion show an inconsistency in the signal. And that's on a digital device as well as an analog device. A little more frequent on an analog device because it is a live spark that's created, not a computer generated source of energy. But the resistance is there. It's all resistance based. The length of the coil, the number of feet of the copper wire, the whole thing is all based on resistance and flows back and forth, which can produce those types of results or those types of activity while you're doing a treatment. Thank you, Silky, for asking that particular question. Anyone else has a question? Just please, let's see. Let's see. I do believe we got a new one. Yep, we do. Got a couple of questions. Let me bring it up here. Okay. Here we go. This is from Wendy, and we'll ring Wendy up and see what her thoughts might be.
This is Wendy.
Hey, Wendy. Good morning. Pat Zemer with Magna Wave.
Good morning, Pat. How are you?
I'm great. You say you got a question?
Excellent. Yes, sir. Let me try to stand where I have better cell reception.
Okay.
I have 3 questions for you.
All
2
right.
human and 1 equine.
Okay.
So the first, with the human, I have an owner of a horse who fell and hurt her knee. She's been to the doctor. Nothing's broken. They just tell her there's fluid on the knee, but it's not in a sac, so they weren't going to drain it.
Okay.
So can Magna Wave help the fluid dissipate faster?
Absolutely. Absolutely. Basically, you're going to massage the area. You're going to stimulate the lymphatic system to be functioning, and can most certainly help move the fluid off of the area. No question.
Perfect. These same people have a horse, a Clydesdale, that has an abscess. And I was over there yesterday trying to get the abscess to blow. Worked on it for about an hour.
Oh my.
Really couldn't see any evidence of it blowing, but the horse was definitely less sensitive.
Okay.
I did put the large loop in the bucket of water that the foot we were soaking, and the owner asked me if the pulse was stronger because of the water being more conductive, and I honestly didn't know how to answer that.
That is correct. There is a
Okay.
there is a school of operation to where people will get into a sauna or a hot tub and then treat themselves. You can get much more intensity. You can feel and take more intensity in the water, and so if you have good massive amount of energy, then maybe the result that you're looking for can be achieved in a more rapid type of manner. So to do it that way would be fine. You could also put the coil underneath. Now, and so this is a good size animal. So you might try. Have you put the small loop around the hoof?
It's a Clydesdale. Her hoof is huge.
I know. I know. Well, either
really get the butterfly around.
Okay, you could kind of arc it around it, like if you put it on your head, you're only covering half the head. So you could put it on and approach it from that situation. You'll be able to probably turn it up higher with the butterfly and get a more intense signal into the area to help bring that a little more rapidly.
Okay, great. I'm going over there again in a few minutes. I'm going to try and get it to come out today. Hopefully we'll have good luck.
Okay, sounds great.
I got one more question for you, Pat.
Perfect.
So I had a woman call me who had pain, rotating pain. Sometimes it was in her shoulder, sometimes it was in her back, feet, knees, and she had heard about me and wanted to give it a try. Sent her all the information ahead of time. Within 2 minutes of treating her, she had what I would call a severe reaction to the magnetic field. Her chest felt tight. She felt nauseous. She felt sick. So we stopped, and I told her this could be the Herxheimer reaction, and she really felt terrible for the rest of the day. She could taste metal in her mouth.
Mm-hmm.
She is perhaps willing to try it again. What I want to be able to tell her is, I'm sure this reaction is going to happen again, but is there any sort of timetable of how long this reaction will happen?
Well, I always say 1 out of 100 people who have a chemical makeup in their body that they're just uncomfortable with this type of therapy. They're also probably uncomfortable around microwaves, and if they're outside by high voltage wires, those types of situations. So if the person is very toxic, now she's got something going on where she's having this pain
For sure.
moving around her body, whether that's a chemical imbalance that's causing that to happen, a vitamin deficiency, or something else that's causing it to happen, certainly plays into this arena. And so with repeated treatments, you are detoxing. But if you have somebody that just has that type of reaction, in some cases you'll do that and they'll feel that, but the next day they feel absolutely wonderful. Now, and I have experienced over the years someone with an RA, rheumatoid arthritis type of situation, that they're just uncomfortable, and it takes multiple treatments before you can find, if they're having the pain today in the shoulder, tomorrow on the hip, you got to kind of chase it around. So I can't say, she may not have it at all the second time. She may, and what I would do, if it took 2 minutes for it to come last time, I would treat her for a minute. And at a very moderate setting, and stop and see how she does. It may be a situation that you want to sneak up on it, if you will. It may be only that she can take comfortably a 1 or 2 minute treatment as she's detoxing, or as this particular situation is being dealt with. So that would be a way to approach it. Treat her hips. If you treat, for example, if you treat her low torso, you're treating her whole body. You're going to get good blood flow improving everywhere, which can help the body better fight off this inflammation that's giving her pain in other areas of the body. If you treat her shoulder and it's close to her lungs and all that, as far as immediate blood flow that makes her uncomfortable, you might be better off to treat her low back and area for just a short period of time. Let her deal with it. Let her body acclimate and deal with it, and move it in that fashion.
Okay, great. Thanks so much, Pat.
Yeah, be sure to send your name and full address to support@magnawavepmf.com, and we'll get you some gear.
All right, thank you much.
Thank you. Have a great holiday. Bye-bye.
You too. Merry Christmas.
Thank you. Okay, great questions. Great sharing of information, so we always appreciate that. Let's see if we've had any other... let's see, got that. That's taken care of. So if you have a question, please send it to me. Do we have something from someone here, Brad? Let's see. Just see my semi equine bundle, and I've been trying the attachments on myself. With the holidays coming up, how is the best way to introduce PEMF to the family? Great question, Jeff. What I would do is, what I do when I first started. Do you have any pain? How's your back? How's your knee? How's your shoulder? How's your elbow? How's your wrist? And if any of them are having that, and I would venture to say, if your family's like mine, everybody's got a little something going on that they're dealing with. And what I would do is just have that conversation. Have a story. Use one of the stories you've heard today. Use a story that I have shared on various videos and various broadcasts about how we used it in our family, and then demonstrate it. The other way to do it, hey, I want to show you what I'm doing and how I'm using it, sit in this chair, put it on their little back, put it on medium, and then put it on maybe high if they want, but just put it on there and let them feel it. It's always intriguing to someone to feel it. So if you put that large loop on their back and started it low and moved it up to medium and high, if that's it, they'll feel the pulsing. They'll feel the sensation in their body, and they'll talk about it. And then you can treat areas if they have areas that need to be treated. So Jeff, great question. Thank you so much for asking, and appreciate that very much. Let's see. Do we have another one here? Looks like we do. Here we go. Are Clorox wipes safe for cleaning the attachments? I cannot get rid of the harsh smell, which I love, but some human clients don't. Baby wipes have been helping with getting attachments clean, but not the smell. I would certainly use Clorox wipes at that point over that to help with that. Now these are the tubing that is used on these is a surgical grade microbial resistant tubing, but that doesn't mean that you're not going to have dirt and hair and stuff like that kind of leaves an odor if it does. But I would certainly use the Clorox wipes to get more intense on it, and if there's something, don't be afraid to spray a little Febreze on it and wipe it in there. That might do something as well. But certainly you could use Clorox wipes to get. You could use, if you want to put a little stronger bleach and put on some rubber gloves and use a rag with a bleachy water type of substance to really get after it. That's fine as well. Great question, Rian, and appreciate it very much. Okay, I think we have another one here from John. Yep, John. Here you talk about improving blood and lymphatic circulation when using PMF. What do you think about the effects others speak about, such as improving ATP, cell membrane potential, etc.? It's easier not to delve. Is it easier not to delve into that? Well, it certainly precipitates and helps the production of ATP in the body, which is the energy to the body, is the fuel of the body. If you want to think about it like that, you get STP for your cars and ATP for your body. So it kind of works in that kind of fashion. So when you're improving the blood and circulation, one thing I didn't say about that is you improve that blood flow by improving the blood oxygenation. And so if you can improve the blood oxygenation, the cells can overall be healthier to better do their job of producing ATP and making the cell membrane potential to be improved. It actually helps the cellular membrane be more permeable, allowing toxins out and nutrients in, allowing more oxygen in, allowing the other nutrients and proteins that you're giving it through your food and supplements to be better utilized by the cellular makeup of the body. So yes, when we get in, start talking about the mitochondrial level and the ATP production and the cellular membrane and all that is all part of conversations that are had. You don't have to go that deep, but and a lot of times it gets too deep for me, and I have papers. Read this paper, let's talk to this doctor. But that's the situation. Great question, and thanks for throwing it up there, John. Appreciate it very much. Are there any others at this point that you're seeing there, Brad? Okay, so if any, got a couple more texts here from people who would like to share something. Let me bring this one up. Just dialing the number here, kind of like dialing for dollars. Oh, how many do we have on the broadcast? Have we gotten to 50? That'd be nice. 31. Oh, come on. Tell your friends. Share this. Let's get it up there, and we'll give away some stuff.
Good morning.
Good morning. How are you?
Very good.
Good. Lori, you have a question, or you want to share a Magna Wave story?
No, this is amazing. I've been doing so much with the Magna Wave, the Max that I have. I haven't even had time to finish my certification, but I will get it done.
Okay.
So one of my clients has a small rescue, about an 11-year-old, looks like a Jack Russell mix, and he tore both his back ACLs.
Oh.
I know. And dog, they did the x-rays and proved that it was not a full tear, but about at least 50% on both legs. And they did 3 weeks of therapy with the typical therapy products, with medicine and TENS unit and acupuncture, and no success. The dog was walking on its front end and toe touching with the back feet. So we started doing the Magna Wave. I have the Max, and I use the small coil on one leg for 10 minutes and the other leg for 10 minutes. And immediately he was able to put weight on both back feet.
Wow.
And so then I waited a week. I would have loved to have done more often. Unfortunately, both of our schedules wouldn't permit it. So I did another week, same exact thing, 10 minutes, as much as the dog could stand intensity-wise. And at that point, the dog could walk, go outside on its own to the bathroom and back. Before, it was been kenneled, out, lifted, carried out, go to the bathroom, carried back in the kennel.
Right. Wow.
So now, after 2 weeks, the dog was able to walk outside, use the bathroom, come back in on his own. After the 3rd week, you could barely notice a limp. And the dog was taken to the surgeon. The surgeon was scheduled, and the surgeon said, well, whatever you're doing, absolutely keep doing, and we're not going to have surgery.
Wow.
So saved her $5,000 right there.
Absolutely. That's one of we got into it, treating our boxer who had horrible hip dysplasia, and we could treat that dog and she'd be fine until she'd chase a rabbit. She'd be good for 7 or 8 days, and all of a sudden she'd go chase a rabbit or a squirrel, kind of mess herself up a little again. We'd have to treat her somewhat to get her feeling good and back in shape, but we never had to have surgery. Same kind of deal. That's a wonderful story. Thank you so much for sharing that.
Yeah, we're on week 6, and the dog is now doing even a little bit of a trot. So I'm documenting everything and keeping it as a case study to hopefully put together. And when they go in for the next x-ray, I'll be super excited to see what that says.
That's incredible. Thank you, Lori, for sharing that. Be sure to send your name and to the support at Magna Wave PMF, and we'll get you some gear.
All right, well, you guys have a great day.
Thanks to you. Happy holidays. Bye-bye.
All right, bye-bye.
Great story. ACL, my personal, I tore my MCL and messed it up and wanted to see the doctor, and he was out of town, so I waited. Didn't want to go to the emergency room. Waited a couple of weeks, went to see the doc, and he looked at me and he said, "Yeah, you've messed it up, but you've got it far enough along now that we're not going to do an MRI. There's nothing else we need to do. Just keep it up, and you'll be okay." And it didn't take 6 months. It took about 2.5, 3 months, and I was virtually moving just like it had never happened. Okay, let's see here. We have another question or call. Get it up here. Okay, I'm getting better at my dialing here this morning, dialing for information. So here we go. Amanda's got a question.
Hello.
Hi, Amanda. Pat Zemer with Magna.
Yes.
How are you?
Good. How are you?
I'm great. Do you have a question?
Yes, I do. So I'm a fairly new practitioner as of last month. So I have got a phone call from somebody I didn't know at the time, and she said that she has been battling lameness for the last 3 weeks. Her horse has been on stall rest, so her farrier and vet are not getting along.
Okay.
So one is saying it's not the hoof, the other one is saying it is the hoof, and so that's where they left it. She got an ultrasound done, she got x-rays done, nothing came up as per the vet. So she said, well, I'm going to give this a shot just to see what happens. So the horse went from dead lame at the walk to, after the first treatment, which was 20 minutes with my hoof box and zoom paddle.
Which machine?
I came back the next day and the horse was sound, but this heat is still in that hoof. And we're now, again, 3 days in. The horse is 100% sound, but she's a little concerned about the lingering heat. And, obviously I can't figure out what it is, can't diagnose what it is.
Right.
But, so now, is this something that could happen? Could it be like a lingering abscess that just hasn't come out, a bruise? Is there anything that, typically it's a reason why that the heat is still lingering?
Now, of course, you understand I'm not a veterinarian, nor a doctor. Of course,
yes.
and so forth. But, just from conversationally thinking and having this...
Yeah.
From an abscess, from a bruise that's there still, or some other type of irritation. Let's just say there could be a spur or something causing some irritation. Could be something, an infection elsewhere in the body that, how you get something and it kind of centers on it's in your abdomen or it's in your shoulder, when you get some different viruses and things like that, they kind of hone in on one location. Could be a referred situation where maybe the doc is talking about that's causing this as a referred type of issue, and so you got to take care of everything to get to that. Could it be lingering?
Okay.
Typically we see it go away, but if the damage was such, it could just take a little more time to get if the nerves are involved, which quite often they are. It's harder to get inflammation out of a nerve and cartilage than it is out of soft tissue, so it just could take longer to deal with.
Okay, and I did do his first treatment. I did a full body on him, and it's his left front and that same shoulder, that left shoulder. I couldn't even get near him with the coil because he was so sensitive.
Right.
So it's just a matter of, I guess, at this point, what is referring what and what is going on underneath everything.
And as the doctor and the farrier are doing, there's a lot of different thoughts and feelings on how that develops. But to work that area certainly can help with the referral thing. I tell two stories. Okay. I'll tell them both quickly. You go to the state fair with the wrong pair of shoes. At the end of the day, your neck and shoulder are killing you, and was your shoes, not anything that you did with your neck and shoulder. It's how your shoes changed your posture. Same thing when you have those type. Now I lost the other one I was going to tell you, but that's how it goes, and certainly just kind of hang with it and stay with it.
Okay. Awesome.
Doke.
Thank you very much.
Well, you're certainly welcome. Be sure to send your name and address to support at Magna Wave PMF. We'll get you some gear.
Excellent. Have a great holidays. Thank you.
To you. Thank you very much, Amanda. Bye-bye.
Bye.
Great question. Great comments to deal with. Let's see. We got another one. Let's go back here. All right. We have one. Let's dial this one up. How are we doing on time? Oh, we're okay just yet. Dial it up. How's our count doing? Are we getting anywhere near? Oh, drop down a little bit. There we go. We're dialing up.
Hello?
Yes, ma'am. Pat Zemer here.
Hey, hi, Pat.
Hi.
Hello. Okay, so I have two things for you. One, I've been treating a client for the last, 2 months.
Mm-hmm.
He has been suffering from lower back pain, and it's like on the right side of his hip where his sciatic is, and it shoots down his leg to the point to where he can't walk. So we've been doing treatments. I started off 2 times a week. We do his head, we do his chest, we'd work his lower back, and then I do both hips.
Mm-hmm.
And then he was able to maintain that pain. So we went to once a week, but now it's starting to come back. And he's been to the chiropractor. He went to a doctor. They did an adjustment. They gave him a bunch of painkillers, but said there really wasn't anything they could do. So I'm wondering if when I go in and do my treatments, if I should be doing something different other than head, chest, and hips and back.
You're basically doing a full body if you're approaching it in that fashion. And obviously there's something going on deeper rooted or deeply rooted that people are talking about. I've always maintained if I treat a horse 3 or 4 times and he's not any better, or he's better but he doesn't continue to improve, there's something else going on. There's some other issue or some other indication that the doctors need to take a look at and see what's going on. So you're doing the right thing to basically treat him systemically in that area, but I would certainly concentrate on the areas of issue.
Okay. And then the next question is, we talked a little bit about feet, and it kind of went in and out for me, so I apologize if you're answering a question again.
That's okay.
But when I do treatments on feet, I've been using the butterfly loops, and then I've also been trying the paddle. But my clients are not feeling anything. Like, we'll turn it up full blast, but when you can hear it, but they're not feeling it the way that they feel it in the rest of their bodies.
Okay, so let's talk about a couple of quick little things here. How old are your clients?
One of them is 55. The other one is 84. And then I've done it on myself, and I can kind of feel it on full blast, but not. I feel like I should feel it more.
Which machine?
The Pulse Pro.
The Pulse Pro. Okay, and you will be able to feel it just fine. And now that depends on what's going on, and you might try to do 2 things if you're using the paddle. Flip the paddle over, and use the other side. It should be balanced, but just once in a while, based on various things, you can get it stronger out of one side than the other side, and because of the way it's focused. You'll feel, if you put the large loop on their shoulder, you'll feel and see more movement than you will out of the paddle, the way the paddle produces its energy. And if you put it on the feet, and I use the paddle exclusively when I'm treating for circulation issues, I'll place it on my heel, in the arch of my foot, and on the toes. And I may feel it more in one spot than I do in the other. They're getting the energy. I wouldn't worry about it. I would treat them and get them the energy, and they will see results.
Okay, so just explain it that way. Is you're probably not going to feel it, but you're getting the energy.
Yeah, I mean you can put it on their shoulder and they're feeling it. Well, the same thing's happening in their feet. And they may put it on their elbow and experience the same thing. They just don't feel it because there's not as much muscle tissue there and soft tissue to reverberate with the signal, if you will. You put it on the bottom of the foot, you're able to be able to turn it much higher, and you will not always feel it the same.
Okay.
Okie doke.
Cool.
Okay. Thank you.
Thank you, sir.
Be sure to write in and get your gear.
Okay. Bye.
Bye-bye. Happy holidays. Okay, another great question. Let's see if we've had any other ones. Everything's quiet at this point. 9:55. We're about out of time. I have another meeting coming up here in just a few minutes. Let's see if is there a question. Let's see. I know it is FDA approved for anxiety in humans. What about dogs, and how often? Hazel, great question. Of course, the modality of PEMF is used for anxiety and depression in humans. And just think it through. It'll do the same thing for a dog. Simply treat the neck, shoulders. You could treat the head, back of the head, certainly lightly as far as the treatment is concerned, but it can certainly serve to calm a dog and deal with anxiety. Now, I had a dog that had separation anxiety, and we would treat her, and she would be better, but she just had a lot of separation anxiety. And so we could get her to where she was calmer, and she also had a horrible fear of thunder, and she'd be just every place. So we would treat her at those times to help her calm down, dealing with those types of situations. So yes, I would certainly use it as an application for anxiety. In people for depression, it can take a whole series of treatments. It's not always put it on once and oh boy, my depressive state or my anxiety is improved. You'll feel better in many cases, but sometimes it just takes a multiple range of treatments to really get it working. And we've shared that interview with one of our clients who came in with clinical depression, and it took weeks, but boy, the change was just very dramatic and long lasting. So it'll do that. Let's see. We have another one. I was also going to mention that down here in Fort Lauderdale, Florida, the max is also sporadic with the pulsing, sometimes quite sharp. Catches the horse and humans off guard at times. Should I be concerned? The unit was a demo and now has 240 hours. I would not worry about it. It's just one of those things that can happen. And what you might do if you're in a situation that you see it happening with some regularity and you wanted, and we can talk about it further, and there's a point that you'll want to have it tuned up, but I wouldn't worry about it with 240 hours at this point, maybe 500 hours, 600, something like that. But just when you put it at the setting, if you know that you're at a setting of some pretty good energy, just back it off a little bit, so if it does get sporadic for whatever the reason may be, it's not uncomfortable, or it doesn't catch someone as much off guard as it could be other than that. I'll be in the Fort Lauderdale area, Lori, here in a few weeks, and maybe we can catch up at some point and say hi, and I can take a look at your device or whatever. So just stay in contact. Let's see, do we have another one? Leanne's got a question. Is it possible to get better results for hip dysplasia on large dogs if I use the wings and have the dog lie down in the center if lying on the floor? Absolutely. You can certainly potentially enhance the result doing that. You could put, if you're talking about the large wings, lay the dog on the wing and then drape the other wing over the other hip, and so you're doing all the way through. Or you could take both wings and kind of cradle them over the rear of the dog, and it being a large dog, and be able to approach it from the back towards the front. So most certainly the large wings will give you more versatility in how you are approaching the area to deal with that. So hope that helps. Leanne, thanks for asking the question here. Let's see, one more thing here got to mention. We're just moving right along here. Got another one. Let's see here.
Hi, Kat.
Hey.
Hi, no, real very quickly here. I had a patient yesterday who came to my facility, and good thing, you know, I mean, and I have to remind patients also that I'm an RN, I'm not an MD, so and I'm in the state of Ohio, which is different than California where I was currently previously. Anyway, I always ask them what medication they're on, just like the horse, if they're on a supplement, because the Magna Wave increases the uptake and the efficacy of the drug,
right?
Whatever supplement. So if they're on Coumadin and then they're going to have a treatment, their blood will be thinned even more.
Correct.
So I told him that we should go at a lower power the first couple times, especially. He gets INRs every week. report back to me what his INRs are going to be so I can document that.
Okay, perfect.
And then reminding all the patients that they need to increase their fluid, and with animals, make sure that they're drinking afterwards, like watch your horses' buckets and watch your dogs or cats, because you want to make sure that you're detoxifying and you're eliminating the waste from the body.
Absolutely. Thank you so much for sharing that, Kathleen.
Okay.
Okay, thank
You're
you.
welcome.
Mm-hmm.
Bye.
Bye-bye.
Thank you.
Bye-bye. Okay, we are about out of time. It looks like no other questions have popped up. Yep, everything's about the same, and I want to thank you for being with us. This will be the last office hours of 2018, I believe, because next Tuesday is Christmas Day, and the following Tuesday is New Year's Day, and a couple days after that, the Magna Wave Express hits the road. Be sure to go out and check out, if you get your Echo for Alexa for Christmas, hook it up and go search out Magna Wave flash briefings. We have a different flash briefing each day covering machine information, protocols, all types of things like that. So it's Alexa. Please do that and check it out. So we'll see you in 2019 again, right here on the Magna Wave Office Hour. So I want to thank you. It's been a great year. It's been fun sharing these Tuesday morning ventures with you to learn and grow and help everyone's wellness with Magna Wave. So wave on to a great new year. Have a nice holiday. Thank you so much. Have a great one. Bye-bye.